Hello and welcome back to Nathan Bell's podcast. Be sure to like, subscribe, and share with your friends. Today, Nate would like to talk about trauma.
Right, today I'm going to talk about trauma. Personally, in my mind, I don't think trauma gets diagnosed enough. I think like psychiatrists and stuff are pretty hesitant to diagnose trauma because I think we have a view in this society that the only people who are traumatized are victims of serious violence and like rape and stuff, but I don't think that's true. My view is that life in the universe is traumatic. And I wrote on my blog, Modern Culture Network, once that life is suffering. And I think to understand that life in the universe is traumatic, you really have to try and picture what a life without any trauma would be. In my mind, we're always battling against some form of trauma. There is always some obstacle which blocks us from being who we want to be. And living how we want to live. So anything that blocks us from being the person we dream of being and living the happiest, most rewarding life that we want to live, anything that blocks that will in some way traumatize us because it prevents us from finding happiness. The Buddhists talk about finding happiness, and this is something we don't talk about enough in the Western world, because in the Western world we sort of think that the meaning of life is just to work and pay taxes, but I really do believe for the individual the meaning of life is the pursuit of happiness, and finding happiness. So with regards to trauma, as I said, things that block us from finding spiritual happiness and satisfaction in life will traumatize us. They will knock us back. A lot of things, and also the world's a terrible place. Like, people want to pretend that the world is this happy, friendly place, but it's not. There's rape, there's murder, there's extortion, there's exploitation, there's abuse, there has been slavery, there's war, there's conflict, there's violence. There's a lot of traumatic things in the world. I'm of the view that just watching the news can traumatize people. So in order to see that everyone's a little traumatized, you really have to think of what the perfect world would be like. And I tend to think the perfect world would be a world where we're all almost still childlike, where we're happy and friendly and we love, and we share and we give and we treat each other with respect and love. And we're all these very naive, pleasant people who don't hurt each other and don't intentionally inflict suffering on others, and that's certainly not the world we live in. So in order to understand that everyone's a little traumatized from the nature of the world and life in the universe, you have to imagine this perfect world where we're all almost still naive like overgrown children, and very friendly and loving, and naive would be the only word for it. But the reality is it's not like that. There's a lot of violence and anger and terrible things in the world, just knowing that can cause you a level of trauma. So I think, as I said at the start, trauma is underdiagnosed, and I think it's this old toughen up mentality where it's like, oh, that happened, you got raped, just put up with it, or you got punched in the face, toughen up, stiff upper lip. There's nothing wrong with that. That's saying, oh, there's nothing wrong with having been treated that way. But the reality is a lot of people get treated in ways that they find unsatisfying and aren't satisfied with. I've been treated terribly by some people in my life over the years, particularly over the last 10 years, and I'm not satisfied that I was treated to the standard that I feel I deserve to be treated. So having been treated that poorly by people has left me traumatized. Now, I feel I should have a diagnosis of trauma, but it seems that psychiatrists are unwilling to diagnose me with trauma. And that, again, as I said, is because there's an unwillingness to diagnose trauma. We reserve that diagnosis for people with severe things like severe violence and rape and sexual abuse and stuff. But I think that trauma should be diagnosed more. And in order to understand that, we have to acknowledge that people shouldn't be hard. You know, we live in this world where everyone tells you to be hard and rough and sturdy and strong, and firm, and to just put up with poor treatment and terrible things like war and atrocities and rape. But it shouldn't be like that. It should be a friendly world. We should live in a world where people are friendly and respectful and loving and compassionate, and where people don't end up feeling poorly treated and abused. But we don't live in that world. We live in this hard man world where everyone has to have thick skin and be really rough and pretend that they don't feel upset and pretend that they don't have emotions. So yeah, my view is that trauma is underdiagnosed, and everyone has, to some extent, trauma, because everyone has suffered, and trauma is the result of suffering, and suffering is the result of dissatisfaction with life circumstances. So we suffer when we are dissatisfied with the circumstances of our life, and this leads to trauma. And tell me someone you know who is perfectly satisfied with the circumstances of their life, and everything has worked out for them and they haven't suffered. There's nobody like that. Everyone has suffered to some extent. Everyone is dissatisfied with something that has happened in their life. So everyone has some level of suffering. So therefore, in my thinking, everyone has some level of trauma. And as I said, to realise that that life in the universe is traumatic, you have to imagine a perfect world where there is no suffering, and no such world will ever exist. There will always be suffering because it is the nature of life in the universe. Again, as I've said before in other videos, it's like the meteorite that struck the dinosaurs. You know, it's just reality. There's death and there's tragedy. You know, things happen. That's the nature of the universe, and there is suffering and death and tragedy. It's the nature of the material universe that we live in. So there will always be suffering. So there will always be trauma. So we pretend like trauma is this thing that only a few people in our civilization have, because particularly extreme things happen to them, and everybody else just needs to toughen up. But I say everybody has varying levels of traumatization, because suffering is the nature of life in the material universe. Because this is not a perfect world. It's a world where circumstances are saddening, upsetting, and terrible things happen. So I think everyone is a little traumatized, and we need to be more willing to doctors need to be more willing to diagnose trauma in more people. And I think the answer to trauma is not. I do think the answer to trauma is like treatment and therapy and medication to some extent. That is the answer to trauma. But I also think the more important answer to trauma is to build a better, fairer world. Because you can treat people with therapy all you want, but if the world is a terrible place, if the circumstances of the environment we live in aren't nice, aren't good, are unpleasant and unsatisfying and unconducive to happiness, then there will be more suffering, so there will be more trauma. So we need obviously to have therapy treatments and medications and all of this to treat trauma, but we also need to build a better world which is fairer and more equal, so people can live more satisfying, happy, rewarding lives. Now I also want to say about trauma, I talked recently about ice use and some of the people I see in Hamilton who pace up and down the street shouting and screaming and smashing stuff. And a lot of that is trauma. And I often observe when I see people walking around the community shouting and screaming, I try to think, well, who are you shouting at? And I listen to what they say. And a lot of the time they're abusing nobody. There's nobody there. They're not targeting anyone in the street. They're just ranting abuse. But I realise these people are playing over arguments they've had in their life, or they're in their outbursts are targeted at people in their life who have hurt them. So when we treat trauma, it shouldn't just be about stopping this aggressive behaviour that we see in trauma patients, first we have to acknowledge that people who walk around shouting and screaming abuse in the street aren't just schizophrenic and aren't just on ice. They're also probably suffering trauma. And then we have to stop trying to just stop them from behaving that way and acknowledge that they have a right to be upset that they have been poorly treated. See, in this country, in this culture, we don't acknowledge that people have a right to feel anger. And I spoke about this in my video on anger. People who have been poorly treated have a right to be angry. They have a human right to express and to feel anger. So we have to acknowledge that and help them build happy, rewarding, satisfying lives. Anyway, I've said enough about trauma today. So there's some thoughts about trauma. So drop a comment in the comment section. What do you think about that?